Have you ever felt pain, burning, or heaviness after ejaculating and thought it was normal? Maybe you assumed it was just sensitivity, fatigue, or part of getting older. But pleasure wasn't made to hurt. Pain after sex is your body calling for help, and the longer you ignore it, the louder it will shout. During pleasure, the entire body works in sync. The brain, heart, nervous system, and pelvic muscles all kick in at the same time. The penis receives an intense rush of blood, the glands contract to release semen, and the pelvic floor tightens to support ejaculation. It's natural and healthy, but when repeated in excess or without recovery, the system overloads. Pain is the first sign. Most men believe that mild pain, burning, or pressure in the pelvic area after sex is normal. It's not. It's your body signaling inflammation, muscle tension, or fatigue. Think of an athlete overworking the same muscle every day. Sooner or later the body asks for a break. With pleasure, the same principle applies. The problem is men rarely connect the discomfort to excess. Many think the more they ejaculate, the better their sexual health. But pleasure also requires balance. The pelvic floor and reproductive system need time to recover between ejaculations. Without that rest, micro-injuries, mild inflammation, and even nerve compression can develop, which explains that diffuse pain so many ignore. Post-ejaculatory pain isn't just physical. It reflects a body that's worn down and a hormonal system being pushed past its limit. When dopamine drops and prolactin rises, which happens after climax, the body enters a brief relaxation state. If this repeats too often, the chemistry derails, and the body starts responding with fatigue and pain. The good news is the body always warns you before something more serious develops. Pain is simply a reminder that it's time to care, observe, and adjust your pace. I'm Emily Collins, a urologist, and today I'll explain why pain after ejaculation is not normal, and what your body is trying to tell you. But before we continue, make sure you're subscribed to the channel. Because here I talk about men's sexual health with scientific grounding, no taboos, and direct language. And tell me in the comments, have you ever felt any discomfort after pleasure? During ejaculation, the male body enters a state of physiological high performance. Everything happens in seconds, but it involves a complex sequence of reactions between the brain, nerves, and muscles. The nervous system triggers dopamine, adrenaline, and oxytocin, speeding up the heart, increasing blood flow, and preparing the penis for climax. At the same time, the pelvic floor, especially the bulbocavernosus and ischiocavernosus muscles, begins contracting intensely. These contractions push semen through the urethra and generate the sensation of pleasure. The issue is that when this process occurs many times in a short span, the body doesn't have enough time to recover. Accumulated tension in the pelvic floor starts causing microspasms and fatigue, which show up as pain, heaviness, or burning after climax. It's as if the very muscles responsible for pleasure start responding with discomfort from overuse. Meanwhile, the seminal glands and prostate work in sync during ejaculation. They produce and release the seminal fluid that composes semen. This requires energy and intense blood flow. When a man ejaculates too frequently, these glands remain constantly active and can become inflamed, what we call congestive prostatitis, one of the main causes of post-ejaculatory pain. The nervous system is also heavily involved. It carries the electrical impulses that command contractions and pleasure. But when stimulation is constant, physical or visual, the pelvic nerves undergo sensory overload, making the body react with increased sensitivity or mild pain. During climax, the body also releases prolactin, a hormone that signals the end of pleasure and induces relaxation. It's natural to feel calm or sleepy right after ejaculation. But when the body is inflamed or tired, that same relaxation can come with pain and pelvic pressure, as if the body can't properly switch off. Pleasure is one of the most complex and beautiful functions of the male body, but like any system, it needs balance. When you understand what's happening inside you, you realize pleasure should create energy, not pain. Now let me show you the most common causes of post-ejaculatory pain and what they reveal about your sexual health. Post-ejaculatory pain isn't a mystery, it's a signal. And almost always, your body is showing that something is out of balance. The good news is that, in most cases, the cause is simple, reversible, and treatable. But you need to know where it's coming from. The first and most common cause is congestive prostatitis, mild inflammation of the prostate caused by excess stimulation and frequent ejaculation. The prostate is a sensitive gland that needs time to decongest after releasing seminal fluid. When a man ejaculates repeatedly, it stays constantly full and irritated. This leads to a sense of heaviness in the groin, burning when urinating, and a dull ache right after pleasure. It's your body asking for rest. The second cause is chronic pelvic tension. The pelvic floor, the muscle group that supports the bladder, prostate, and penis, contracts strongly during climax to expel semen. If this region is always tight, due to anxiety, poor posture, a sedentary lifestyle, or excessive masturbation, it can't fully relax. The result is pain, pressure, or burning at the base of the penis and in the area between the scrotum and the anus. The third cause is nerve irritation. The pudendal nerve, responsible for genital sensitivity, can be compressed by muscle tension or local inflammation. When that happens, pleasure comes with mild discomfort, tingling, or pain radiating through the groin and inner thighs. The fourth cause is chemical and hormonal overstimulation. Too frequent pleasure makes the brain release dopamine, adrenaline, and prolactin over and over. This constant oscillation wears down the nervous system, alters pelvic blood flow, and contributes to small inflammatory changes in the prostate and seminal vesicles, a kind of sexual fatigue that shows up as pain. And the fifth cause, often overlooked, is a mild urinary or seminal infection. When there's burning, strong odor, unusual discharge, or persistent pain, your body may be fighting bacteria. In these cases, the discomfort doesn't resolve on its own, and requires evaluation by a urologist. Though different, these causes share something: they're all responses to imbalance. Healthy pleasure doesn't leave pain, it leaves lightness. Now I'll explain how inflammation and physical stress turn pleasure into discomfort, and what to do to break this cycle. Inflammation is the language your body uses to say something is wrong. It doesn't appear suddenly, it's the result of a process quietly repeating until the body begins to react. In the male reproductive system, excessive sexual stimulation is one of the most common triggers. During ejaculation, the pelvic muscles and reproductive glands go to work. They contract, pump fluid, and operate under pressure. When this cycle happens too frequently without rest, the body responds like any overworked muscle, with microinjuries, fatigue, and inflammation. That inflammation can center in the prostate, seminal vesicles, or even the nerves in the area. Inflammatory prostatitis is the classic example. It arises when prostatic fluid accumulates and irritates internal tissues, creating discomfort and heaviness. It isn't an infection, it's the body's reaction to excess. The same occurs with the pelvic floor. Chronic tension compresses vessels and nerves, impairs circulation, and causes pain. Inflammation can also stem from physical and hormonal stress. Intense pleasure releases dopamine and adrenaline, but your body needs time to process that surge. When it happens daily, the sympathetic nervous system, the one that keeps you on alert, stays switched on. That creates a state of constant tension, muscles don't relax, circulation worsens, and tissues slowly inflame. Over time, this produces diffuse pain, not a single point, but a constant whisper, slight burning, a jab at the base of the penis, pressure in the groin. It's the body in overload. And here's the catch: when a man tries to relieve that discomfort with more pleasure, the effect is the opposite, the inflammation intensifies. The body wants to heal, but excess prevents it. It needs recovery, hydration, movement, sleep, and above all, pauses. Inflammation is the body's request for rest, and pain is the reminder it's not being heard. Ignoring this process is how simple tension becomes something more serious. If inflammation persists, it can spread to deeper structures, harming performance and even desire. Now I'll explain when pain stops being temporary and starts signaling something more serious happening in your body. Not all pain is just a sign of fatigue. Sometimes it's your body warning that something more serious is going on, and ignoring it can be costly. The problem is most men wait for pain to get worse before acting. They only seek help when the discomfort already affects erection, pleasure, or urination. But the body always gives warnings before that point. The first sign something more serious is happening is persistent pain, the kind that keeps showing up for days even without sexual activity. That suggests prostatic inflammation or pelvic nerve irritation. If pain hasn't gone away after 2 or 3 days of rest, your body is already asking for a medical evaluation. The second sign is burning when urinating or after climax. This may indicate a mild urinary or seminal infection, often caused by bacteria that settle in the prostate or bladder. Left untreated, these infections can become chronic and directly affect potency and desire. The third sign is blood in semen or urine. Even small amounts are never normal. It can be related to significant inflammation, infection, prostatic stones, or, in rare cases, more serious lesions. This is not a wait-and-see symptom, it needs immediate evaluation. The fourth sign is deep discomfort in the pelvis, lower back, or groin that worsens with physical effort or after sex. This pattern is typical of chronic pelvic pain syndrome, a multifactorial condition involving muscle tension, inflammation, and even emotional stress. It's one of the most common causes of post-ejaculatory pain in men who live under pressure and anxiety. And the fifth, most neglected, sign is declining pleasure and erection alongside pain. When the body hurts, it activates protection mode. The brain reduces desire and arousal to avoid more stimulation. That creates a dangerous loop: you feel pain, lose desire, push through anyway, and worsen the issue. Persistent pain is an alarm. The worst mistake is trying to silence it with painkillers or pretending nothing's wrong. Your body doesn't want to be muted, it wants to be heard. Seeing a urologist isn't weakness, it's wisdom. The earlier you understand the cause, the easier it is to reverse. Now let me show you how to relieve and prevent post-ejaculatory pain with simple, natural, effective care. Pain after pleasure doesn't need to be part of your routine. The male body has an incredible capacity to recover, as long as you give it what it truly needs: balance, rest, and care. Pleasure should leave you light, not tense. When you respect your body's pace, it responds with vitality, potency, and comfort. First step: allow recovery time between ejaculations. The prostate, seminal vesicles, and pelvic muscles need 48 to 72 hours to fully decongest. This pause reduces prostatic congestion and lets the body re-establish hormonal balance. The more you respect this interval, the lower your chance of pain. Second step: hydrate well. Few men realize dehydration thickens semen and makes expulsion during climax harder, forcing pelvic muscles and irritating tissues. Drink enough water throughout the day. It helps eliminate toxins and prevent inflammation. Third step: both strengthen and relax the pelvic floor. Simple exercises, light contractions and deep breathing, improve circulation and reduce the muscle tension that causes pain. Just don't overdo it. The secret is control, not brute force. Fourth step: avoid excessive stimulation and mechanical pleasure. The brain and body respond better to real, mindful experiences. Reducing pornography and making room for touch, bonding, and more natural pleasure restores nervous system sensitivity and reduces physical stress in the genital region. Fifth step: maintain an anti-inflammatory diet. Fruits, dark leafy vegetables, fish, and nuts help reduce inflammatory processes and improve prostatic function. Avoid excessive alcohol, very fatty foods, and long periods of sitting, all of which increase pelvic congestion. Lastly, prioritize sleep and daily stress management. Sleeping too little and living under pressure raises cortisol, an enemy of hormonal balance and muscle recovery. A tense body feels more pain, a rested body feels more pleasure. Prevention is simple: listen before your body has to shout. Now let me show you why healthy pleasure never hurts, and how caring for your body is the greatest act of masculine potency. Pleasure wasn't made to hurt. When your body aches after sex, it's not punishing you, it's warning you. Pain is a silent language, a way your body communicates when a limit has been crossed. Ignoring that language is like switching off a fire alarm and pretending the flames aren't there. Healthy pleasure recharges your energy, it doesn't drain it. It relaxes the body, clears the mind, and makes the heart beat in balance. But for that, you must respect your body, understanding that each ejaculation is an intense process involving hormones, muscles, and emotions. Like any system, it needs pauses. Many men believe more pleasure equals more virility. True power is knowing when to stop. The man who masters his rhythm preserves his potency. Pleasure isn't about quantity, it's about quality, awareness, and connection. When you care for your body, pleasure changes meaning. It stops being a discharge and becomes an exchange. It stops being a habit and becomes balance. A healthy body responds with intensity, firmness, and ease. Pleasure becomes a source of energy, not a reason for pain. I'm Emily Collins, a urologist, and I see this every day. Men arrive worried about discomfort, but once they learn to listen to their bodies, they turn pleasure into something far bigger than a moment. They discover the kind of pleasure that strengthens, the kind that starts in the mind and ends in harmony with the body. Post-ejaculatory pain is reversible. With care, pauses, and attention, the body recovers, inflammation drops, and pleasure becomes true pleasure again. Because healthy pleasure doesn't hurt, it heals. If you've made it this far, congratulations, it shows you want to understand your body and care for your sexual health consciously. Now, subscribe to the channel, because here I talk about men's sexual health with scientific grounding, no taboos, and direct language. Leave your like if this video helped you understand your body better and comment below, my pleasure is healthy. And for those who stayed until the end, the next video is already on the screen. There I explain how to protect your prostate and maintain potency with simple, natural habits. Click and keep going with me, because knowing your body is the first step to mastering your energy.